This project was funded by the World Health Organization, and they put together a scheme along with the architects to build a naturally ventilated clinic in Kenema, Sierra Leone, and it was for Lassa fever patients. It needed to be low cost and low maintenance, but we still needed to have a high quality healthcare environment. So with natural ventilation, we needed to ensure that there was sufficient ventilation effectiveness getting into the ward. Because it was a Lassa fever ward, you need to be able to dilute any infectious particles out. Well, we were asked to analyse the ventilation effectiveness of a typical ward, and we also wanted to check that there was enough fresh air getting into the space so we could dilute any airborne contaminants. We also wanted to look at thermal comfort of patients, including the clinicians who will be fully gowned. We found that because this hospital is so close to the equator and therefore the sun's very high in the sky, shading from nearby trees actually had hardly any effect. So what we suggested to the architects was that they could increase their roof overhang and actually create a shaded walkway, and in doing so that would help to shade those southern windows. Well, we undertook a dynamic thermal model to look at air temperatures over the course of a year, and we then did a computational fluid dynamics analysis which looked at the effect of wind on the building, and from that we can look at air change rates in the space to ensure they're getting enough ventilation. What we've demonstrated is that this space can create a low transmission between patients and a comfortable environment for patients to be.